All right, let's look at Atlas A that you will have to know information from for your next quiz or test that I have set up for you. So I'm going to look at the anatomical position. This is considered to be the anatomical position. So if we do any type of hand movements, joint movements, we're stemming off of this particular position. So when we look at it, we see that the palms of the hands are facing directly forward. Her feet are forward, knees are forward, everything is forward. She's facing forward as well, and she's standing erect. And her arms are at the side. This is considered to be the anatomical position. Now let me do a type of joint movements. Let me go back a little bit. This position that she's in, her arms are considered to be in the supine position. The palms are facing forward. Now when you turn your hand over facing the back or facing downward, is called forearm pronation. So palms up facing forward is called supination, forearm supination, and when you turn the wrist facing and your palms facing downward, it's called forearm pronation. You see how the radius has rotated and is now on top of the ulna. Now we have these anatomical planes. We have three major planes. We have frontal, sagittal, and our transverse plane. When we look at our frontal, the frontal plane is what's going to separate the body from anterior from posterior. So that's basically front and back. But we're using the medical terms anterior and posterior. So it's going to extend vertically. Of course, it's going to be perpendicular to this sagittal plane. When we talk about perpendicular, basically meaning it's going to meet at a 90-degree angle, perpendicular. Okay. So we have our sagittal plane, which runs horizontally. You might see a horizontal plane, transverse plane. What am I talking about? Oh, sorry. Let me do a transverse plane since I'm talking about here. Our transverse plane is what's going to run horizontally. You'll see horizontal plane. It's going to pass through the body, and it's going to separate the body from superior and inferior. So let's be the top half from the lower half. Now we'll look at the sagittal plane. This is the sagittal plane, and that's going to separate the body, divide the body into left and right. Thinking of the word sagittal, S for side, left side from the right side. Hope you guys remember that. Okay. Now when we look at it, the body's not always divided in equal parts, equal left and right sides. Sometimes we'll have a mid-sagittal or median sagittal plane, and that's going to run directly. That's the one that's going to run directly through the middle of the body. But then sometimes you have it off to the side, either on the left or right side, where it might be here, basically from the shoulder to the side of her face, coming all the way down, but still separating into the left and right. That would be a parasagittal plane. So it's dividing the body into unequal left and right sides. So here's just a few diagrams of what it looks like when we have our different types of sections. You have a sagittal section, remember left and right side. This is what the body will look like inside. Here we have a frontal section dealing with separating or dividing the body into posterior and front, posterior and anterior. And then you have our transverse plane, which separates the body from top and bottom, or superior and inferior. Alright, so we have some directional terms. These are very important. When we talk about ventral, we're dealing with towards the front. Just the front part of the body. Also dealing, another word for ventral will be anterior. So you'll see anterior and ventral used interchangeably. Okay, it all depends. Anterior is dealing with the side, the ventral side. The ventral is basically in the front or the belly. Okay. Dorsal or posterior, we're dealing with the back. The dorsal side, the dorsal is dealing with the back or the spine. Cephalic, we're dealing with the head or the superior end. Rostral, we're dealing towards the forehead or the nose. Caudal, toward the tail or inferior end. Superior and inferior, you should know what those are, above and below. We have our medial, towards the midline. Lateral, away from the midline. Proximal and distal, closer to the point of attachment will be our proximal. Our distal will be further away, furthest point away from the attachment point or the origin. And then we have ipsilateral, which is on one side of the body, on the same side of the body. So they give an example as the liver is ipsilateral to the appendix, because it is on the same side of the body. And with contralateral is on opposite sides of the body. So the spleen is contralateral to the liver. Then we have superficial and deep. Superficial and deep. Superficial dealing with closer to the body's surface, and deep meaning further from the body's surface. So of course the skin is superficial to the muscles, but the bones are deep to the muscles. So you are going to see these terms again. Make sure you know. I may not give you every single one, but you still need to study which ones you need to study every single one, because you don't know which one I'm going to give you. These are just, go back. They're just showing you different parts of the body, how that's the cranium, the knuckle is basically the back of the neck. So make sure you are familiar with these words as well. Okay. Alright, so when we look at the major regions of the body of an axle, and you have an appendicular. You're dealing with the axle, we're dealing with what? The head, the neck, and of course with the trunk. Everything in this color, this pinkish looking color here. In the trunk, we're dealing with the thoracic and the abdominal region. Okay. Now when we're dealing with appendicular, we're really dealing with the upper and our lower limbs. You have, when we deal with the upper limbs, we have the brachial region, which deals with the arm, and the antebrachial region, which is the forearm. So this is the brachial region. This is our antebrachial region, our forearm. Then we have the manual region and the digital regions. The manual region deals with our hands, and our digits are our fingers. We deal with the lower extremity. We deal with the femoral region, which would be the thigh region, and the crural region, which is the leg. Then we have our torsal region, which is our ankle, and our digits, which is our toes. Now you have to make sure that you know that if a person obtains an injury in their left quadricep or somewhere within the thigh region, you don't put on your report patient obtained a laceration in their leg, and the doctor will come in and start looking at their ankle. Looking at their leg, which is between the knee and the ankle. It's basic medicine, medical terms. This is your leg. From your knee to your ankle is your leg. From your knee to your hip, this is your thigh. So make sure you know the difference between the two. Thigh, leg. Alright, so we have quadrants and we have regions that our body is separated into. You can't see them, but we just separate them into quadrants to make things a lot easier. We have 4 quadrants and we have 9 regions. You will see a diagram like this again on your test or quiz. You have to know where these regions are. Where these quadrants are. We have 4. This is our right. This is our left upper. Then we have right and left lower quadrants. You can see in this diagram the various organs that we have situated within our left and right quadrants. Okay? We have 9 regions. We have down the center, we have our epigastric region, our umbilical region, and our hypogastric region. On either side, we have a right hypochondriac region and we have a left hypochondriac region. We have a lumbar region, a left and a right lumbar region. We have a inguinal region. You see the name right here, INGUINAL, an inguinal region, a left and a right linguinal region. We have lines that are going to separate these regions, going horizontal. Separating the hypochondriac and the lumbar region is our subcostal line. Separating our lumbar and our inguinal region is our intertubercular line. And of course, running down or running vertical, we have our mid-clavicular line. So we have 3 lines separating, 3 major lines separating, well, there's 4, but these midline and mid-clavicular, there are 2. But we have these lines that are going to separate these regions. You need to know the lines and the regions. Make sure you know left and right. We have our segments. These are regions between one joint and the other joint. They're helpful in describing the locations of bones and muscles and movements of the joints. In the forearm region, this is our forearm region, we're dealing with the wrist and the elbow joints. In our femoral region, we're dealing with the hip and the knee joints. Our crural region, we're dealing with the knee joint and our ankle joint. Those are just segments. We have various cavities. We have a cranial cavity, which contains the brain. We have a thoracic cavity. What's that going to contain? The heart, the liver, just to give an example. No, it's not liver. The heart and the lungs, sorry. We have a diaphragm that's going to separate the abdominal region from the cavity, from the thoracic cavity. And that abdominal region is going to contain a lot of the major organs, the small and large intestines, the spleen, the liver. Okay. Then in our pelvic region, what do we have? The reproductive organs. Yep. But in this small little canal going down here, we have the spinal cord. Alright. Now within this thoracic cavity, we have a pleural cavity, which basically lines each of the lungs. Now when you combine the abdominal cavity and the pelvic cavity, it's considered to be the It's considered to be the abdominal pelvic cavity. Alright, so in your textbook, table A.2, it names the various cavities as well as the various organs that you have located in that particular region. So make sure you're familiar with that as well. I'm not going to get into these right now because you'll definitely get into details with this when we get to the cardiovascular system as well as the pulmonary system. And I'll press forth. Alright, so we have a number of body systems. When we look at our body systems, look at the body systems, we have a number of them. You're going to have to remember what they are. How are you going to remember them? Wow, it's a lot of words. It's a lot of systems. I don't know. Some of them are very self-explanatory. You should be familiar with something. So I'm going to help you remember all of them. I use this type of acronym. I do it in all of my classes. That's a D. Minds are, I see you, cruel. Minds are cruel. Minds. Let's do M. M is for muscular system, integumentary system, nervous system, digestive system, skeletal system, respiratory system. We have circulatory system, dealing with the heart. Then we have reproductive system, male and female, urinary system, endocrine system, and lymphatic system. That is all of those. These are all of your systems. 6, 7, 8, 9, 10, 11. 11. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. These are your systems. Muscular, integumentary, dealing with the skin, nervous system, digestive system, skeletal, reproductive or respiratory, it doesn't matter, it's an R, respiratory, circulatory, reproductive, urinary, endocrine, and lymphatic. These are your systems. You're going to have to know what they are. Because I'm going to ask you, what's a primary organ? If I say hair and nails, what system is that in? Are you going to say skeletal? Of course not. Muscular? No. Lymphatic? No. Some of them are very obvious. You can say, okay, it's in the integumentary system. We're dealing with the skin. What's the function of the skin? Of this integumentary system? To protect the internal organs from the external environment. How about vitamin D synthesis? Non-verbal type of communication. Okay. Our skeletal system. We have bones, cartilage, and ligaments. It's very easy. What are the bones and cartilage used for? Some is very obvious. For support, movement, protection and closure of the viscera, blood formation, mineral storage, electrolyte, and acid-base balance. Now our muscular system, what's the primary organs? Skeletal muscles. The muscles. Muscles of the body. There are over 600 muscles in the body. And we have 207 in the adult. 207 bones in an adult body. Then we have our lymphatic system. If I ask you about lymphatic vessels, our spleen, our tonsils, what am I referring to? Lymphatic system. Our nose, pharynx, larynx, trachea, bronchi, lungs. We're referring to the respiratory system. Alright, and here's the other ones. Nervous system, endocrine system, circulatory, digestive, male and female reproductive tissues. If I say, okay, what system holds or contains the prostate gland, the testes, the penis, obviously we know it's the male reproductive system. So make sure you go through these various systems. We have 11 of them. Minds are cool. Will help you remember them all. Alright. So systems for fluid transport. What would that be? Our circulatory and our lymphatic system. Alright, we have system of input and output. What system do you think that will be? Respiratory, urinary, and our digestive system. Input and output. For the respiratory system, it's inputting oxygen, outputting carbon dioxide. When you do with the digestive system, what's it bringing in? Food. Our macromolecules. What you putting out? Feces. Then we have systems of protection, support, and movement. What do you think that'll be? That's right. Integumentary system, skeletal system, and our muscular system. Integumentary system is there for protection, support and movement, Systems of reproduction, that's very easy. Male and female reproductive systems. Then we have systems of internal communication and integration. What do we have? nervous system, and the endocrine system. These are just examples. Okay? So, if you have any questions, post it again on Blackboard. This will be in your very first test. I'll tell you that right now. You have to know these stuff. So please take the time out and study the stuff in its entirety. You will see these words again. Alright? Talk to you guys later.